Hi everybody, this is Dr.nabiha. We're going to discuss today a subject of breastfeeding. The objective of this lecture, at the end of this lecture, you should know the advantage of breastfeeding and you should know what's the factors that influence the production and the secretion of the milk. What are the criteria for under and overfeeding and what is the proper technique for breastfeeding? Is there any difficulties for breastfeeding? Is there any contraindications? And at the last, you should know short notes about colostrum. Human milk is the most appropriate of all available milk for the human infant because it is uniquely adapted to his or her needs. Breastfeeding has short and long term medical and neurodevelopmental advantages. The decision to breastfeed should be considered as a public health issue and not only a lifestyle choice. American Academy of Pediatrics and WHO recommend that infant should be exclusively breastfed or given breast milk for 6 months, and it should be continued with introduction of complementary food for at least 12 months or longer. Breastfeeding should begin as soon as after delivery as the condition of the mother and of the baby permits, preferably in the first hour. It should be noted that the diet of the mother during breastfeeding should contain enough calories. The milk is very important and it can be replaced by 1 gram of calcium. Also, she had to increase her fluid intake. There is so many advantages of breastfeeding for both mother and the infant. For example, it's always readily available at the proper temperature and need no time for preparation. It's fresh and free of contaminating bacteria which reduce the chance of GIT disturbance. The allergy and the intolerance to cow's milk, which create significant disturbance and feeding difficulty, are not seen in breastfed infants. There is also psychological advantage of breastfeeding for both mother and the infant. This is probably due to increased bonding between the mother and the infant. There is decreased incidence of some of the medical conditions, like, for example, otitis media in the first year of life in an infant who breastfed exclusively for at least 4 months. Finally, human milk containing some of bacteria and viral antibodies. Human milk containing relatively high concentration of secretory immunoglobulin A antibody. There are so many substances in the human milk which can inhibit the growth of some of viruses like mumps, influenza, and rotavirus. These ingested antibody from human colostrum and milk, it may provide local GIT immunity against organisms that entering the body via the throat. Also, human milk containing macrophage. Macrophage normally present in the human colostrum and the milk. It may be able to synthesize some of substances like complement, lysozyme, lactoferrin, interferon against viral infections. Also, human milk containing lactoferrin. It is the iron-binding whey protein, thus normally 1/3 saturated with iron. This substance had an inhibitory effect on the growth of E. coli in the intestine. Just remember that the human milk iron is well absorbed by the infant, but at 4 to 6 months of life, the diet should be supplemented with addition of iron-fortified cereal or foods, or by adding one of the ferrous iron preparation. Conditions for which human milk may have a protective effect. Human milk have been shown to have a protective effect against some of the infection during the first year of life, like diarrhea, otitis media, urinary tract infection, necrotizing enterocolitis, septicemia, and botulism. It also have a protective effect against a malignancy like childhood cancer, lymphoma, and leukemia. It also has been noted that children who are breastfed, they have lower rate of hospitalization and mortality during the first year of life. Factor influence milk production and secretion. There are so many factors that may affect milk production and secretion. For example, in endocrine factors, many hormones affect milk production and secretion like prolactin, oxytocin, and thyroxine. Some of the anatomical factors like nipple retraction, the presence of infection like herpes zoster infection. Mechanical factors, which mean that the breast should be fully evacuated to enhance the process of milk production and secretion. Also, psychological factors like stress, fear, happiness, relaxation. There are so many maternal factors also to affect milk production, like maternal nutrition, or general condition like presence of fatigue, and so on. Also, some drugs affect milk production, for example, antiepileptics, chlorpromazine. Physiology of breastfeeding. Breast milk produced and secreted by reflexes in both baby and the mother. Baby use rooting, sucking, and swallowing reflexes to locate, nipple, and feed. As a result, tactile receptors in the maternal nipple will activated, which will send signals into the hypothalamus. Hypothalamus then send an efferent impulses to the anterior and posterior pituitary gland. In the anterior pituitary, prolactin secretion, it will stimulate milk secretion by the cuboidal cell in the acini of the breast. While in the posterior pituitary, oxytocin secretion results in the contraction of the myoepithelial cells in the alveoli, which will force milk into large duct. That is called let-down reflex. Now we're going to talk about technique of breastfeeding. Before starting breastfeeding, both hands and nipples should be cleaned. The infant should be hungry, dry, neither cold or too warm, and he should be held in comfortable semi-sitting position for his and her enjoyment and for ease of eructation without vomiting. Mother also should be comfortable and completely at ease. The infant usually will enjoy the breast in 5 to 20 minutes as a range. The infant should be permitted to suck until satisfied unless the mother has sore nipples. After feed, the infant should be erected over the mother's shoulder. He should be placed in a supine position or on the right side to facilitate emptying of the stomach. Both breasts should be used at each feeding. Okay, now after knowing all the advantage of breastfeeding, one may ask himself a question: is there any complications of breastfeeding? Well, the answer is yes. There are some potential complications of breastfeeding. For example, during breastfeeding, the amount of milk intake will be not none. Also, there is risk of transmission of infection from the mother to the baby. Some of the infections, maternal infection like CMV, hepatitis B, and HIV, can be transmitted from the mother to the baby. Hyperbilirubinemia and particularly breast milk jaundice can be occur in a breastfeeding baby. Although this condition is mild, self-limiting, and just continue on breastfeeding. Also, there is risk of transmission of the drugs that's taken by the mother, like antimetabolite and some other drugs are contraindicated. So before taking any drugs, we have to stress this point to the mother, just check the formulary. There is nutrient inadequacy in breastfeeding. Breastfeeding beyond 6 months without timely introduction of appropriate solid food, it may lead to poor weight gain and risk of rickets. Low vitamin K in breastfeeding may result in a condition known as hemorrhagic disease of the newborn, so supplementation is required. Also, during breastfeeding, there is risk of potential transmission of environmental contaminant like nicotine, alcohol, and caffeine. The process of breastfeeding is less flexible, so other family members cannot help the mother or take part. It's more difficult in public places. Lastly, the mother will have some emotional upset. If there is any difficulty or lack of success, it can be upsetting for the mother. Now we're going to talk about difficulties of breastfeeding. First of all, acute breast engorgement. In the second stage of lactogenesis, physiological fullness of the breast occur. Breast may become engorged, that is to say it will become firm, overfilled, and painful as the pattern and the volume of the milk production will adjust to the infant feeding schedule. Incomplete removal of the milk as a result of poor breastfeeding technique or the infant illness, it can cause engorgement. Breastfeeding immediately at the sign of infant hunger will prevent this condition from occurring. To reduce engorgement, breast should be softened before infant feeding with a combination of hot compresses and expression of milk. And in order to reduce inflammation and pain, Between feeding, a supportive bra should be worn, cold compress applied, and oral nonsteroidal anti-inflammatory drugs should be administered. Secondly, nipple pain. One of the most common complaints of breastfeeding mother that occur in the immediate postpartum period. This is mostly result from poor infant position and improper latch. These complaints is the most common causes of the nipple pain beyond the mild discomfort that's felt early in the breastfeeding. If the condition persists and the infant refuses to feed, then the mother requires evaluation for the nipple candidiasis. And if candidiasis is present, then both the mother and the baby should be treated. The mother should be treated with antifungal cream that should be whipped off breast just before feeding, and the infant should be treated with the oral antifungal medication. Mastitis usually occur in 2 to 3% of lactating mothers. It is usually unilateral. Usually mastitis manifesting with warmth, tenderness, edema, erythema that's seen after the second post-delivery week. Usually mother presented with sudden onset of breast pain, myalgia, fever, nausea, vomiting, and sometimes even headache. The most common organism seen is Staph aureus and E. coli. Diagnosis is usually confirmed by physical examination, and for treatment we require oral antibiotics, analgesics, and to promote breastfeeding or emptying the breast. In infant, difficulties in breastfeeding can be resulted from the nasal obstruction, which could be due to upper respiratory tract infection, which can be treated simply by normal saline drops. Oral thrush, which is treated by gentian violet or nystatin. It can be resulted from tight tongue, medical condition like cleft lips and cleft palate, or the infant could be poor sucker, like seen in extreme prematurity, or they having hypotonia, like seen in CNS disorder, or he may have other structural congenital anomalies. Now we're going to talk about inadequate milk intake. Insufficient milk intake with dehydration and jaundice in an infant, it can occur within the first week of life. Usually those infants presented with sign of lethargy, delayed stooling, decreased urine output, and weight loss that exceed 10% of the birth weight. We all know that normal infants usually suffer from weight loss during the first week of life. However, this weight loss does not exceed 10% of the birth weight. While infants with inadequate milk intake, they usually presented with weight loss that exceed 10% of their birth weight. Also, those infants will presented with sign of hypernatremic dehydration. They usually have inconsolable crying and increased hunger. The causes of inadequate milk intake, it could be due to insufficient milk production, or it may be due to failure of established breastfeeding. There might be some health condition in the infant that will prevent proper breast stimulation. Parents should be counseled that a normally breastfed neonate should feed in a range of 8 to 12 times per day, with a minimum of 8 times per day. In order to diagnose an infant to be having an inadequate milk intake, we can start with a careful prenatal history. This history can identify maternal factors that's associated with this problem. For example, if the mother gives us a history of failure of the breast to enlarge during pregnancy and or within the first few days following delivery. Also, a direct observation of breastfeeding, it can identify an improper technique of breastfeeding. Also, if a large amount of milk can be expressed manually after breastfeeding, this may suggest that the infant may not be extracting enough milk, so it eventually will leading to decreased milk output. Putting in mind that a late preterm infant with a gestational age between 34 to 36 weeks, they have an increased risk of what is called insufficient milk syndrome. This is because they may have a poor suck and swallow pattern, or they may suffer from some of the medical issues. Now, the criteria for underfeeding is that the baby will cry all the time, you have long meal time, he suffers from sleeplessness or very short sleeping time, he suffers from colic, which is due to air swallowing, restless, and screaming. The infant will complaining from constipation and unusual hunger diarrhea. There will be decreased urine output, loss of weight, and the taste of way to feeding will be below normal. On the other hand, criteria for overfeeding, the infant will have regurgitation, vomiting, large bulky stool, abdominal distension. Also, he may suffer from colic. There will be increase in the urine output, polyuria. You have sweating and overweight. Now, let's talk about contraindications of breastfeeding. It is a very important subject to know. As we said that breastfeeding is ideal for most infants. However, there is some medical condition in which breastfeeding is contraindicated. From that medical condition is the presence of markedly inverted nipples in the mother, or if the mother having an acute infection. Also, some drugs if had been taken by the mother, like cytotoxic drug and anticoagulant like warfarin, if administered by the mother. The presence of some of the medical conditions like septicemia, nephritis, eclampsia, profuse hemorrhage, an active infection like active TB, typhoid fever, or breast cancer and malaria. Some other medical condition in the mother like poor nutrition, substance abuse, or if they having suffered from psychological upset like severe neurosis and postpartum psychosis. A very rare condition, however, a non-condition is breast milk allergy. This is although it's a very rare condition, but it represents a contraindication to give breastfeeding for the infant. Also, if the infant having an inborn error of metabolism. Some infants having severe congenital anomaly like cleft lips and palate. This also represents a contraindication for breastfeeding. Absolute and relative contraindications to breastfeeding because of maternal health conditions. An HIV infection and human T lymphocytic viral infection. In the United States, breastfeeding is contraindicated. However, in other settings, health risk of not breastfeeding must be weighted against the risk of transmitting viruses to the infant. In TB infection, breastfeeding is contraindicated until the mother completes 2 weeks of appropriate therapy. When the mother having varicella zoster infection, infant should not have a direct contact with the active lesion. Infant should receive an immunoglobulin. If the mother having herpes simplex infection, breastfeeding is contraindicated only if an active herpetic lesion present near the breast. In a CMV infection, cytomegalovirus may be found in the milk of the mother who have CMV seropositive. Transmission through human milk causing symptomatic illness in the term infant is uncommon. Both in hepatitis B infection and hepatitis C infection of the mother, breastfeeding is not contraindicated. Although infants born to hepatitis B surface antigen positive mother should receive routinely hepatitis B immunoglobulin as well as hepatitis B vaccine. Alcohol intake should be limited during breastfeeding. Also, although cigarette smoking is not contraindication of breastfeeding, we should discourage cigarette smoking in a lactating woman. Chemotherapy and radiopharmaceutical represent a generally contraindication of breastfeeding. Breast milk collection. The pumping of the breast milk is common practice when the mother and the baby are separated. Good hand washing and hygiene should be emphasized. There are so many types of the breast pumps. Electric breast pumps are generally more efficient and better tolerated by most mothers more than mechanical pumps or manual expression. The collection kit should be cleaned with hot soapy water, rinse, and air dried after each use. A glass or plastic container should be used to collect the milk. It should be noticed that refrigerated breast milk can be used within 48 hours, while frozen breast milk it can be used for up to 6 months. Milk should be thawed rapidly by holding the container under running tipped water, and it should be completely used within 24 hours. It should never be microwaved. Colostrum is the first milk produced immediately after delivery at the 3rd to 10th days of life of the infant. It then will be transformed into transitional milk, and finally it will become a mature milk. The amount of colostrum is small, it's only 15 to 50 cc per day. It is a bright lemon in color, more alkaline than milk, and it has more specific gravity. It has anti-infective and laxative effect, so it is beneficial to get rid of meconium. The contents of the colostrum: colostrum containing high protein, it's about 2.7 grams per 100 cc. The fat is 2.9 grams, lactose 5.3, and just half grams of minerals. Colostrum differ from mature milk in that it's containing more protein and immunoglobulin. However, just remember that although volumes are low, water or formula supplementation is not required.